Good day, class. I welcome you to study session 2 of pharmacodynamics and chemotherapy. This study session will discuss pharmacokinetics. It's a very common term in pharmacology. Moving to the introduction, the purpose of drug treatment is to prevent, to cure, and control various diseases states. In order to achieve this goal, enough drug doses must get to the target tissue so that the therapeutic yet non-toxic levels are obtained. Pharmacokinetics looks at the movement of a drug over time through the body. The clinician must recognize that the speed of onset of drug action is controlled by 4 fundamental pathways of drug movement and modification in the body. The four fundamental pathways are absorption, distribution, metabolism, and elimination, which are the processes that are involved in pharmacokinetics. At the end of this study session, you should be able to describe absorption of drugs and the factors that affect drug absorption. You should be able to explain the process of drug distribution and the factors that affect it as well. You should be able to discuss drug metabolism and its kinetics and describe the process of drug elimination. First, let's start with absorption of drugs. Absorption is the movement of a drug into the bloodstream after administration. There are some factors that affect absorption, and they include the way a drug product is designed and manufactured, whether it is in capsule form, it is in tablet form. All these will affect the absorption of the drug. Also, its physical and chemical properties and the physiologic characteristics of the person that is actually taking the drug. Absorption affects bioavailability, that is how quickly and how much of a drug reaches in its intended site of action. Physiologic characteristics that may affect the absorption of drugs taken by mouth include how long the stomach takes to empty the drug. Then what is the acidity, that is the pH of the stomach, and how quickly is the drug moved through the digestive tract. Moving to dissolution. In most common situations, a tablet is ingested and passes through the esophagus to the stomach. The rate of dissolution is a key target for controlling the duration of a drug's effect, and as such, several dosage forms that contain the same active ingredient may be available, differing only in the rate of dissolution. The rate of dissolution is described by Noyes-Whitney equation as shown on your screen. That is dW over dt is equals to dA into bracket Cs minus C over L, where dW over dt is the rate of dissolution, A is the surface area of the solid, C is the concentration of the solid in the bulk solution medium, while the Cs is the concentration of the solid in the diffusion layer surrounding the solid. The D is the diffusion coefficient, while L is the diffusion layer thickness. If a drug is applied in a form that is not readily dissolved, the drug may be released more gradually over time with a longer duration of action. Having a longer duration of action may improve compliance, since the medication will not have to be taken as often. Additionally, slow-release dosage forms may maintain concentrations within an acceptable therapeutic range over a long period of time, as opposed to a quick-release dosage forms, which may result in a sharper peaks and troughs in serum concentrations. The rate of dissolution may be modified primarily by altering the surface area of the solid. The surface area may be adjusted by altering the particle size, which is micronization. Ionization of drug. The gastrointestinal tract is lined with epithelial cells. Drugs must pass or permeate through these cells in order to be absorbed into the circulatory system. One particular cellular barrier that may prevent absorption of a given drug is the cell membrane. The lipid solubility of the ionized drug that will directly determine its rate of equilibration. In the stomach, drugs that are weak acid like aspirin will be present mainly in their non-ionic form, and weak bases will be in their ionic form, since non-ionic species diffuse more readily through cell membranes. Weak acids will have a higher absorption in the highly acidic stomach. The Hadamson-Hassbach equation offers a way to determine the proportion of a substance that is ionized at a given pH. The formula is on your screen. For acids, you have pH of pKa plus log A over H of A, where for bases we have pH is equals to pKa plus log B over BH plus. What are the factors that influence absorption? Relating to the drugs, we have some factors, and relating to the body, we have some factors which are highlighted on your screen. So the drugs, we have lipid water solubility, the molecular size, the particle size, degree of ionization, the physical forms, chemical nature, dosage forms, formulation, and concentration. Then related to the body, you have area of absorptive surface, vascularity, the pH, the presence of other substances, gastrointestinal motility, functional integrity of absorptive surface, and disease condition. When a drug moves through a system like the GIT quickly, when one has diarrhea, it will not be well absorbed compared to when the drug moves slowly. That is, when there is no diarrhea, the drug will be more absorbed. Let's look at drug distribution. Distribution is a branch of pharmacokinetics which describes the reversible transfer of drug from one location to another within the body. And once a drug enters into the systemic circulation by absorption or direct administration, it must be distributed into the interstitial and intracellular fluids. Each organ or tissues can receive different doses of the drugs, and the drug can remain in the different organs or tissues for a varying amount of time. The distribution of a drug between tissues is dependent on the vascular permeability, the regional blood flow, cardiac output, and perfusion rate of the tissue, the ability of the drug to bind tissue and then plasma proteins, and its lipid solubility. The pH partition plays a major role as well. The drug is easily distributed in highly perfused organs such as the liver, the heart, the kidney. It is distributed in small quantities through less perfused tissues like the muscles, the fat, and peripheral organs. The drug can be moved from the plasma to the tissue until the equilibrium is established. The volume of distribution of a drug is a property that quantifies the extent of its distribution. Drug metabolism. The liver is a major site for drug metabolism, but specific drugs may undergo transformation in other tissues. Drugs can be metabolized by a process of oxidation, reduction, hydrolysis, hydration, conjugation, condensation, or isomerization. Whatever the process, the goal is to make the drug easier to excrete. The enzymes involved in metabolism are present in many tissues, but generally are more concentrated in the liver. During metabolism, drug metabolism rates among patients varies. Some patients metabolize a drug so rapidly that therapeutically effective blood and tissue concentrations are not reached. In others, metabolism may be slow, that usual doses have toxic effects. Individual drug metabolism rates are influenced by genetic factors, coexisting disorders, particularly in chronic liver disorders and advanced heart failure, and also drug interactions. For many drugs, metabolism will occur in two phases. There's phase 1 and there's phase 2 reaction. In phase 1 reaction, it involves formation of a new modified functional group or cleavage, and these reactions are not synthetic, which involves the process of oxidation, reduction, and hydrolysis. The phase 2 metabolism reactions will involve conjugation with an endogenous substances like glucuronic acid, sulfate, glycine, and these reactions are synthetic. The metabolites formed in the synthetic reactions are more polar and they are more readily excreted by the kidneys in urine and by the liver in bile than those that are formed in the non-synthetic reaction, which is the first phase of the reaction. Some drugs undergo only phase 1 or phase 2 reaction. Thus, phase numbers reflect functional rather than sequential classification. What are the factors that affect drug metabolism? We can have age, sex, genetic differences, nutrition, pathological conditions, route of administration, effect of drug on metabolism. There are also other factors too that can affect drug administration, like nutrition, the intestinal flora, sex differences, and so on. Drug elimination. The kidney is the major site of drug elimination. Renal elimination of a drug can be done by the glomerular filtration, where drugs will enter the kidney through the renal arteries and then which the renal arteries which divide to form a glomerular capillary plexus. Free drugs flows through the capillary slit into the Bowman space as part of the glomerular filtrate. Then proximal tubular secretion, that's another way of renal elimination. Drug that was not transferred into the glomerular filtrate leaves the glomeruli through different arterioles which divide to form a capillary plexus surrounding the nephric lumen in the proximal tubule. The other process is through distal tubular reabsorption. Here, drugs move towards the distal convoluted tubule. Its concentration increases and exceeds that of the perivascular space. A patient presenting with phenobarbital overdose can be given bicarbonate, which alkalinizes the urine and keeps the drug ionized, thereby decreasing its reabsorption. The removal of drug from the body may occur through a number of routes. The most important of them is from the kidney into the urine. The other routes can be through bile, the intestine, lung, or breast milk, especially in nursing mothers. A patient who is suffering from a renal failure will undergo extracorporeal dialysis, which can remove small molecules like drugs. What are pharmacokinetic parameters for elimination? 1. Plasma half-life or half-life of elimination is the time required to eliminate about 50% of the absorbed dose of a drug from an organism. Then we have clearance, which is the plasma volume that is totally free of the drug per unit of time, and it is measured in units of volume per unit of time. Then another term is the steady state. A steady state is reached when the drug supply to the blood plasma is the same as the rate of elimination from the plasma. Thank you for listening. Bye.